guess we'll put you over there. Hey everybody, tonight my name is Duncan. We're gonna be going over an understanding of butyrol for the pharmacology teach back presentation video. Uh, just a quick slideshow, help us get through it. I'll be going over dosage, administration, mechanism of action, some contraindications, some indications, when to use it, when not to use it, and we'll go from there. So first out, we're going to be understanding uh, butyrol. Sorry, this is the first time using this kind of presentation platform. So, critical role of albuterol. Um, Albuterol is primarily how to make you smaller. Anyway, butyrol primarily is a go-to. We think of respiratory or respiratory problems, generally asthma, COPD, wheezes, some kind of bronchial constriction. So butyrol is renowned for its rapid relief of acute respiratory symptoms such as shortness of breath, wheezing, generally in a few minutes of giving it. It's very fast acting and is why we prefer to use it as one of our frontline medications for asthma, COPD exacerbations. Again, anything with any kind of bronchial constriction to improve and make the patient better fairly quickly. Uh, a basic blowdown of how it works is it improves airflow. The way it improves airflow, it relaxes the bronchial muscles. Um, very simply put, your asthmatics, they normally don't have a problem getting air in. Their problem is getting the air out due to air, and a lot of their distress comes from air trapping or the dead space, poor exchange. Um, Ultimately, the poor ventilation of in and out will lead to the poor respiration, which will deteriorate the asthmatic patient. But generally, just a down dirty kindergarten version of it is just it improves air in uh, by relaxing the bronchial muscles, which in turn will allow at least in asthmatics to get the air back out. I'll go into a little bit more depth of how it works uh, here in a little bit. Um, it's also an emergent medicine to use, but it can be more of a prolonged to a point to use. It's not necessarily just 911. A lot of people with asthma will use it um, in their everyday life without needing to call the ambulance or EMS. Basically, patients using albuterol frequently report increased exercise tolerance, allowing them to engage in physical activities with less discomfort. Crucial in maintaining a healthy lifestyle, especially in asthma patients who are often limited due to physical exertion, which could cause flare-ups or exacerbation of their asthma. Role in asthma management. It's rather large. Albuterol is one of the main staples in long-term care. Um, that being said, it's not the primary choice of drug for everyday use, but it's used in the long-term care of acute emergencies, if that kind of makes sense. But it helps when they start feeling it come on, they can hit it and get that relief and get it to calm down before it really gets flared up. The mechanism of action is how, like I said, we'll talk about. There we go. Sorry, I had to mess with my earbud. Anyway, uh, so basically, an essential, more advanced version of how it works is it facilitates bronchial dilation by stimulating the beta 2 adrenic receptors in the smooth muscles of the airways, which leads to muscle relaxation, resulting in the widening of the air passages that improves airflow and reduce respiratory distress. Basically, it acts on those beta 2 receptors. It is a beta 2 agonist, and it does help reduce the swelling of that bronchial airway. The action of butyral on smooth muscle leads to rapid muscle relaxation, leading to decreased airway resistance. This relaxation effect is critical during asthma attacks and episodes of bronchial spasm, allowing for easier breathing. So here you'll see what the airway could look like in an asthmatic or a chronic COPD or chronic bronchitis, things like that, where they have that wheezy trouble breathing. Um, and then after the result of giving the ideal result of giving the albuterol. Again, the impact on breathing is rather significant. It can go from a patient feeling they can't breathe at all to being able to feel like they can breathe again, which, as we all know, any kind of patient you get that feels as if they can't breathe, it's an immediate fight or flight response. They're wailing, flailing at everything, trying to breathe. So if we can get them to that point of getting the albuterol in, we can help relax them some as well on top of their breathing. So they're not as stressed and causing more exacerbation of their illness. Down to dosaging and administration, it's going to be pretty simple forward. There's, at least for us in EMS, there's two main ways that we give it. One is more patient assisted with their own device, their own inhaler. The biggest thing to remember with that, though, is for their dosages, we don't necessarily get into the micrograms of albuterol with their own inhalers versus the count of their puffs. So the big thing to remember is for adults, our doses is up to two doses before we need to consult to repeat anything like that, or if they need additional um, with their inhaler, will be uh, one dose is two puffs. So generally, for if it's their own inhaler, we can do the four puffs, two doses. Children, it's the same up until the age of just under 2 years old and under. Um, we do their inhaler. But generally, if we're going to be involved, especially as paramedics on the ALS side of things, we're probably going to be administering our own nebs, our own DUA nebs. Um, so that dose is going to be an actual metered, more precise measurement of the 2.5 milligrams, generally suspended in 5 milliliters of saline or whatever the solution is, depending on your jurisdiction's mix. But that will be put into a nebulizer and then nebulized at anywhere from 6 to 8 liters per minute for the patient to breathe in. And for, again, the adult dose from 2+ years of age and older for children and to include adults is 2.5 milligrams. And looks like I did have a little bit of a typo here, so I'll explain this one, what this 1.25 milligrams means. But anybody under the age of 2, if they need to have an inhaler, or excuse me, a nebulized treatment of albuterol, excuse me, will be the 1.25 milligrams. Routes of administration, how we just kind of touched over. Some of the other ones, you can have your meter dose inhalers with your blockers, or I'm sorry, excuse me, your spacers, your MDIs, uh, regular inhalers, nebulizers, face masks, the breathe, what I call the breathing teas, um, and go from there. Inhalation's obviously going to be the most efficient form for this medication to work because it allows it to get directly in contact with the area that it's going to be affecting and treating. Um, Most people who have asthma or diagnosed with asthma generally will carry their inhaler around, and always take asthma, especially when an asthmatic patient calls EMS as a more serious uh, type of call because they're able to know when it's too much. because they're used to living with it. They're used to using their inhaler, and if their inhaler is not getting relief, you need to be very cognizant of it and treat those patients rather quickly and more aggressively with our ways of treating for asthma and our airway algorithms. Again, inhaler versus nebulizer. Inhalers, again, we don't really carry them. That's more of a patient thing. They're meant to be carried with them in their pockets, easy to get to, versus carrying a whole nebulized kit with them. Normally, at home nebulizers kind of look more like this. It's a little powered unit that they can do in with a face mask, or versus ours, we're missing this piece, the nebulizer box, because we just directly plug into our oxygen and it'll come up to our nebulized chamber. Contraindications and dosage guidelines. So, as far as contraindications uh, in the EMS emergent field, the only time you're going to withhold albuterol is if it's a drastic, deadly effect from hypersensitivity. But even then, we still need to weigh our options. What's going to be the best for the patient? Um, in my 13, almost 14 years of in being an EMS, I've never seen anybody so hypersensitive to albuterol that it's ever been withheld. Um, there may be some cases where the patient tells you, albuterol really kind of gets me going uh, with their heart rate or other side effects, but it's not necessarily a withhold contraindication. So it'd be safe to say that because this hypersensitivity is kind of a catch-all um, for when there's really none to say. Some pre-existing conditions to kind of be mindful for to see if there can be any exacerbation of the medication or undesired effects. People with hyperthyroidism, diabetes, seizure disorders, uh, their side effects from the albuterol may be ramped up a little bit due to those other disease processes. Okay, bear with me a second. I have lost my space. 2 seconds. We can get rid of that one, that one, that one. All right, sorry about that. I technological difficulties with me still learning how to use Apple products. And anyway, back to albuterol. The pre-existing conditions, just kind of keep an eye out for some of these and know that you may see heightened side effects. Timing and situational use. Buterol is indicated for acute asthma attacks and should be used as needed. However, routine use in chronic conditions must be carefully evaluated to avoid potential desensitization or decreased effectiveness. Just like with any medication, you take it all the time, it's going to actually start having a less desirable effect simply because your body just gets used to it. It loses its potability um, for that medication. And yes, I'm not really sure if that's a word. And if it's not, it is. So, again, like I said, buterol is not really your choice for chronic everyday use to treat asthma. It's more of your emergent as needed treatments for medications. And that's basically everything that I can tell you about albuterol.